Joining us in our studio now, Dr. Robin Williams, former Niagara Medical Officer of Health and a special advisor to the region's COVID-19 Vaccination Task Force. Welcome to the program, Dr. Williams.
Thank you so much. Glad to be here.
It's a pleasure to have you. Let's talk about this task force and your involvement with it. We're rolling out this vaccination here in Niagara, and things seem to be progressing the way they are expected to be, finally.
Yeah, absolutely. And I mean, the finally really has been about vaccine supply. There's no question that it's been a national, international problem, and I think there's finally a really good line of sight on supply. So I think the Niagara Health System and the Public Health Department have really done yeoman's work over the past months with the meager supply that they've had. But now the channels are open, it really is flowing. I'm ever so hopeful that we'll soon have pharmacy channels here in Niagara and also more primary care, as well as the mass immunization clinics that Public Health are setting up and the continuance of the Niagara Health one. So I am very hopeful that we're going to quickly go through the tranches of ages and risk categories to get Niagara vaccinated and back into a more normal life, more normal economy, healthier, happier families. So lots of good signals. So you asked about the task force. It's chaired by Dr. Deck, appointed through Jim Bradley and the regional chair, and it is in support of the health department, bringing all the different partners from the region so that we've got all the shoulders to the same wheel. So pharmacists, paramedic, fire, police, a number of the NGOs in the area, and of course the Niagara Health, and then the health department. So meeting weekly at the region, and just trying to make sure that we've got all the wheels turning and everything going as best we can, given the flow we're expecting of vaccines.
So far, people 80 and above have been vaccinated, and this week we opened up to, was it 75?
75, so
80?
This morning. I have worked provincially. I'm also a special advisor provincially, and I've been working on the provincial IT challenges, including the case and contact management system that we brought in through the summer and fall, and most recently on the vaccine rollout. So the provincial booking system has been something extremely near and dear to my heart. A few little hiccups last week, but nowhere in North America have they opened a provincial level booking system that didn't crash. Ours didn't crash. It had a few little blips, but this morning's has went remarkably. There are over 130,000 appointments booked by noon on the portal for the 75 and older. We've got, some patches of areas that are able to move more quickly. They got vaccine earlier. And we've got some challenging, the northern area in particular that aren't able to move as quickly. But in Niagara, we've got a good handle on the over 80-year-olds, either booked appointments or actually immunized. And so it was absolutely time for Niagara to open to the 75 and over. And pretty soon we'll be 70 and over and 65 and over. At the same time, if we get the pharmacy channel going here, then that's 60 and over, any ages with the AstraZeneca. So we are really fortunate that we've got 3 very good vaccines. I flogged flu vaccine for years when efficacy was sort of 20, 30, 40,
right.
50%. Like this is 80, 90% effective against bad disease, against death, against even little disease. These are wonderful vaccines. So we're very fortunate given this horrendous pandemic that we're in.
You mentioned the flu vaccine. I couldn't tell you the brand name of any of the flu vaccines that have been administered over the years. This is an odd situation that we're in to even know the names of the companies that produce this vaccine. Interesting
observation. And in fact, I can't remember flu mist, like you're right, I don't even know which companies we have dealt with over the years, but because there is so much focus on the efficacy, the new technologies, the mRNA vaccines, the adeno delivery vaccine, that it's just amazing the world we're in to actually try and fight that cute little Pixar-looking COVID. Yes. It looks so cute on the TV when look what it's doing.
Not so cute when it's inside of you.
Yeah.
Let me get this clear. You retired in quotes in 2011 as the medical officer of health in the Niagara region, but you've never really retired with all of this work that you're doing as a special advisor and more. When you look at the burden on Dr. Mustapha Hirji right now here in Niagara, what goes through your mind?
I think he's done an exemplary job. I think that the stress, fear, and anxiety that our population has felt, has dealt with, the isolation, the worry for themselves and their families has not always brought the best out in our population. I know provincially, as well as other medical officers, there have been some very challenging moments of public health leadership, actually in North America. Early on in the summer, there were a number of public health leaders that resigned in the States in particular. So I don't think it's been, I know it has not been an easy time. And I think Mustapha, with the challenges that he has personally faced, has faced them with grace and courage. I think he's made the best decisions he could on behalf of Niagara. And I think he too is celebrating that we're in a hopefully better phase. I mean, he's still dealing with the actual outbreak at the same time as we're trying to immunize, but you know, the light at the end of the tunnel is the immunization side. So I wouldn't want to be him, but I absolutely support him in every way that I can as we move forward with this.
You dealt with your own virus that was threatening to really spread, SARS, back in 2003.
Yep.
This is very different because it has reached so much of the population.
Yes.
But what lessons did you learn back then that are being applied today?
We learned lots of lessons. I was on some of the review and renew panel, the Walker panel, that came out with a whole variety of recommendations, especially with respect to infection control. Also reorganizing of public health, also, you know, the stockpiles that were needed for pandemics. And some of those learnings faded away in the lives we were leading, that we lost sight of some of that. I suspect we won't lose sight of that again going forward. However, it did leave us with our arms behind our backs for personal protection, for a whole variety of things that shamefully caused significant illness and death, especially in our eldest, rest and retirement, long-term care. So I think we will continue to learn from that. We've got a whole challenge, don't we, going forward in terms of how we grow old safely together in this society.
For sure. Dr. Williams, thank you so much for joining us, and thank you so much for doing what you're doing on that vaccination task force.
It's a pleasure to work on a constructive, positive thing against that little Pixar.